Hello, good afternoon, good evening, and good morning to everyone joining today's Ask WHO session about COVID-19. As usual, I'm joined by Dr. Mike Ryan and Dr. Maria Van Kekrhove, who will be answering your questions today. If you are watching, just a reminder, as we haven't done this in a while, if you're watching us on Facebook, you can ask your questions using the comment section. If you're watching us on Twitter, you can use the hashtag AskWHO. And if you're watching us on LinkedIn, you can also use the comment section, and our team will help me curate your questions and pass them on to Mike and Maria. Mike, Maria, good afternoon. Thank you for your time. We're seeing that COVID-19 conversations are gaining less and less attention, and we get this feeling that the pandemic is over. But is this right or wrong, and what are your main concerns at the moment with this outbreak?
So perhaps I can start. Thanks for having us back. It's been a while since we've had an opportunity to chat with you. I think you're right. I think there are less and less conversations about COVID-19, certainly in the media and the general public. But I think that's a reflection of a couple of things. One is that COVID is one of the many issues that people, as individuals, communities, governments are dealing with, and so there's a lot on right now. Whether these are health crises or non-health crises, or earthquakes and floods and displacement and war and energy crisis. There's just a lot going on. And COVID is only one of the many challenges that we face. But on the other thing is that we're in a different stage of this pandemic. We're in a much better place in dealing with COVID-19. The challenge is getting that balance right of having enough attention on this pandemic and on this particular virus to understand what the risks are for individuals, to make sure that you continue to do what you can to keep yourself and your loved ones safe, and also to live your lives. And we are also trying to work with all governments in all countries to ensure that the right systems remain in place to deal with the unexpected or deal with the continued risk that we know about with COVID in terms of this virus's ability to hurt people, put them in hospital and kill them, but also use the tools that protect people and prevent them from going to hospital and prevent them from dying. And so that's wonderful, that we can focus on those aspects. But the pandemic is not over. The public health emergency at a global level is not over, although we are working very hard to end that in all countries, end the emergency in all countries. But COVID is a disease we will have to manage as we go forward. And so there is less and less attention, but it is our responsibility to ensure that accurate information is out there so that individuals know what they need to do, what governments know what they need to do to keep fighting this virus.
Thank you, Maria. Mike, and maybe we can hear your reflections as well on what are your main concerns at the moment when it comes to this virus.
Um, I think, I think that idea that Maria alluded to, keeping yourself informed, keeping yourself safe while living life, I think is good. And I think many people are in that situation. They've had their vaccinations, or if they're older, they've had boosters. They still are careful about having, exposures. Certainly, there was a lot of the virus circulating in Europe, also flu virus, and many people with underlying conditions, vulnerable people, really try to avoid infection this winter. You wore masks, avoided crowded spaces. I was doing it myself, not for COVID per se. I really didn't want to get flu. I got my flu vaccine fairly late, and I spent the Christmas period thinking, oh God, I haven't had enough time for the vaccine to take hold. I hope I'm not infected, because I think many people out there will have noticed, and I don't know whether it's anecdotal or not, but there's been a fair bit of respiratory disease around the place. And people have been saying to me, God, I've been so sick the last week, but it's not COVID, it's something else. Or other people getting COVID. I'm so surprised, that they have it, and couldn't believe that the virus is still around. So I think what's beginning to happen is that COVID-19 or SARS-CoV-2 is joining the pantheon, the list of respiratory viruses that are circulating at any one time in the world. And depending on the season, depending on the mixing of people, depending on the variants or subtypes that are circulating, we're going to see different patterns of respiratory disease over time. And the impact of those patterns of disease will depend on how well protected the population is, either through vaccination, how strong the health system is in dealing with cases and treating people with antivirals, be it Tamiflu for flu or other antivirals for COVID, and in particular, whether or not we people with older persons or people with underlying conditions can avoid heavy exposure to these viruses and becoming sick despite being vaccinated or protected in another way. So I think we're kind of entering that period, but we're not completely out of the woods on COVID yet, because this virus still has a lot of kinetic energy. It's still evolving. We're still seeing variants emerge. It's not settled entirely into a calm space. So I think, and I think, Maria, when you were developing with the team those scenarios, there were two kind of scenarios. One is that this virus gradually peters out and becomes part of that landscape of viruses we face. But there is another scenario where we have a bit of a reset and we go backwards, and that we get a strain or we get a subvariant that has capacity to transmit, but also maybe a little bit more severe, or one that has immune escape, one in which the existing immune responses in our body through vaccines or natural immunity are not able to protect us from infection, and particularly from severe infection. Right now our vaccines are doing that. I think it's remarkable actually the way in which the current grouping of vaccines across all the vaccines have provided very high levels of protection against severe disease and death. We've been very lucky. We should be very grateful for that. But again, there are pockets of people unvaccinated, there are pockets of vulnerable people unvaccinated, and the virus still has a lot of kinetic energy. So we're not out of those woods yet by any means at all. But at the same time, I'm really thrilled to see people getting back to their lives. I'm thrilled to see people back going to sports events. I'm thrilled to see people being able to travel and see their friends and family again. So maybe we're finding a way to live with the virus. We're working on it. We're working on it. But I would still implore people who aren't vaccinated, people who, particularly older people or people with underlying conditions, if you haven't been vaccinated, to make sure you do, because I think that's your best protection. Even at this stage, there's still a significant risk for an unvaccinated, unprotected person to have a severe case of disease. And remember, 38,000 people are dying every 28 days. So we're talking about 40,000 people a month now. Still, that's a lot way down on what it was. It's still a lot of people. And we need to recognize that. And they're 40 or 30, sorry, did I say 48,000? I said 32,000, sorry, I don't know where that number came from. 32,000 deaths in the last 28 days. But it's still 32,000 too many. And many of those are avoidable. Many of those deaths are avoidable.
Thank you, Mike. And we're already receiving questions from our viewers. But Maria, before we go to those, maybe you can reflect on what does it mean we are not out of the woods yet. So what is the epidemiological situation? I know in terms of cases, these statistics are not so reliable, but maybe that's in hospitalizations.
Yes, so we are still asking member states to report to us the numbers of cases, because we need to track this virus around the world and understand the intensity of circulation. Right now, the data that we are receiving from member states in terms of how many active infections there are right now is not as a reliable indicator as it was previously. And that's because surveillance has changed. Testing has dropped greatly around the world. But we know that this virus is circulating, and in many parts of the world, if not all, it's really circulating unchecked. What we also need to be able to better measure is the impact. And so what we've also asked all of our member states to report are the number of hospitalizations. How many people are being hospitalized with COVID? How many people who are hospitalized require advanced care in an intensive care unit, for example? And how many people are dying? We do get death data. There is a delay in the death data because it takes time for people to either recover or for them to succumb to disease. So that takes some time. And we do see this decoupling. So there are waves of infection that are occurring, but the hospitalization waves are not as high. They're not as intense as they were previously, and that's a good sign. But we are still seeing, as Mike said, we still see 32,000 people dying every month. It fluctuates in terms of how many are dying, but a few weeks ago, 40,000 people died in a week. And these are deaths that can be prevented through the tools that we have. Early diagnosis to get to clinical care. So this is when I say we're not out of the woods, and when Mike says we're not out of the woods, there remains a significant risk of developing severe disease and death from this virus. And in particular, if you're not fully vaccinated, if you're not vaccinated. if you do not have access to the antivirals early in your disease course, if you do not have access to clinical care by incredible health workers around the world using therapeutics if you happen to have advanced disease. And so there's a lot of work that needs to be done there. And on the vaccination side, we're working with our member states to ensure 100% of the at-risk groups have been vaccinated and boosted. We're in year 4. Immunity wanes over time. This is something that is expected. This is something that happens. And so it's not even, have you been vaccinated, but when was your last vaccination? And so the data on hospitalizations, it's quite limited, I have to say. Our teams, our incredible teams across WHO, pulling in data from different member states, we were looking at the number of countries that were sharing hospitalized data. And that's unfortunately very low. Out of our member states, only 34 countries right now are providing hospitalization data. I hope I got that correct, but I'm looking at the data in front of me. And only 23 countries are providing data on ICU capacity. And so for us as an indicator, we need to be able to look at the trends. Is severity changing? Are hospitals being overwhelmed? Because COVID plus flu, plus RSV, plus other viruses are circulating, and those beds need to be occupied by people who need care. If we could prevent people from needing a hospital bed because of COVID, because we have vaccination, because we have early care like antivirals, this frees up that bed for somebody else that needs it. And that's what we're really looking for. So there's a lot to do in that space, and we implore our member states to provide more data on the impact, particularly looking at hospitalization utilization and looking at ICU. And I would say that the trends that we have on hospitalization are not geographically representative of the whole planet, because we have very few countries that actually provide this. But we do see some increases in hospitalization in some countries across Europe, but that increase is not the same level as the increase we saw in previous peaks. So it's increasing, but it's not as intense as it was in some of the highest peaks. And I think that's a difference, because we are learning to live with this virus. We have no choice. We have no choice. Let me rephrase. We are living with this virus. We are learning to better manage it as we go forward. And that's what we want to support our member states to do, to keep people alive so that they can go on and have healthy lives using the tools that exist.
Thank you, Maria. And we are receiving questions actually on measures in terms of masks. Why masks are not widely used anymore. So maybe we can help our viewers understand when they should wear a mask still, despite there's no obligation to do so, but to protect themselves.
Yeah, well, you're the expert. No, I can only give you my own personal story. I mean, I come to work on the bus, as I've said many times, and I wear my mask on the bus. I wear the mask when I go into the local store at the train station, because it's always packed full of tourists and backpackers at the main train station. We wear masks here at WHO when meetings in which physical distance can't be maintained, but we sit here, we've got good distance. We don't wear masks. So I would say mask wearing is less prevalent, yeah. But again, I think people who are trying to protect themselves or protect a loved one at home are still wearing masks when they feel that they can reduce their risk. And again, it's about reducing your personal risk by in certain circumstances, just saying, I will reduce my risk of being exposed to this virus for the next hour by wearing a mask because I'm on a bus. It doesn't mean you won't get infected. As soon as you walk off the bus and walk into a coffee shop where you might have a cup of coffee without a mask, that might be the moment that you're infected. You don't know. But over a week or over a month, you do tend to reduce the overall risk. So I think they're the situations where a person like myself can reduce risk. I think that's more of a question for an older person who may have an underlying condition, who may really want to avoid getting infected, and they may choose to wear a mask in more circumstances than I might choose to wear a mask. Yeah. And maybe I'm 22 years old and trying out for the college football team. Maybe I don't wear a mask or wear a mask in even less situations than I would, or someone older than me would. And I think that's what's evolving. I think what's good, and I've seen this, and I think it's great in the last few months, people have become more accepting and more sophisticated. I think people are saying, okay, if he's wearing a mask, then he has a reason to do that. So there's a bit more acceptance. There was a little bit of negativity, why someone is continuing to wear a mask. Someone said to me about 3 months ago, are you trying to make a statement with that mask? And I'm going, no, I'm just trying to protect myself, So there was an element of that. I don't know your perception, Alex, on social media, but I do get a sense that there's a little bit more tolerance on both sides of that equation. And I also think that, I don't know, maybe I'm wrong, but people are going into crowded spaces again. But people are also a little bit more conscious around their personal space. And if they have a choice, they'll sit outside, or they'll, I think our rules and parameters on personal space have slightly changed. It'll be interesting to see if that's a reality. But I just get a sense that people, where they can, enjoy that physical distance. And I think this winter, there's been so many different respiratory bugs around that actually maintaining a bit of physical distance and sometimes wearing a mask has probably protected a lot of people from not only COVID, but from other winter respiratory viruses.
I think it's also important to reiterate what our guidance is. Mike has given a lot of examples that illustrate the guidance that we've put out. And we're talking for the general community here, because our guidance for health workers is very clear. Using medical masks, wearing respirators, wearing other personal protective equipment when working in healthcare facilities, when treating known or suspected cases. That's a very different scenario. It's very clear they need to be well protected when they're caring for those patients. But in the general community, our recommendations are, it's one of the measures we recommend. Mike mentioned several others: keeping distance, taking a step back, thinking through what you need to do during the day and how you can do it as safely as possible. But wearing a mask in the general community, looking at what your risk profile is, if you have underlying conditions, your age, if you're vaccinated or not, if you're fully boosted or not, especially when you are indoors. And if you don't know if there's good ventilation, and most people don't know what the ventilation is in a building that they're in, to wear a mask when you're around others for prolonged periods of time, and certainly if you can't keep your distance. So I think that it's important that we reiterate that our guidance still recommends wearing of a mask as part of a comprehensive approach. We also recommend improving ventilation in buildings where we work, we live, we study. We also recommend physical distancing where feasible. We know that that's not possible everywhere, but certainly in packed situations when you're around others that are not part of your immediate family, it's important to take that risk-based approach while you live your life.
Thank you so much, Maria. We also have questions around vaccines, and you both highlighted the importance of getting vaccinated and also being up to date. There is a question we addressed several times before, but maybe it's worth explaining again. Our viewer on Twitter is asking, how come the vaccines don't prevent infection or transmission?
It's a great question. So initially, in the vaccines that are out there, that are in use, are designed to prevent severe disease and death. And they are incredibly effective at doing so. We were talking, I keep reflecting on the early days of this, and there was no guarantee that we would have a vaccine that would do this. And now we have so many that are out there that have undergone these clinical trials, that have undergone safety reviews, that are out there that prevent severe disease and death, and they still are doing that. They do have an effect on preventing infection and some transmission, but that's not their intended design. That's not their primary focus. There are some vaccines that are in development that are focusing on this, some of the inhaled ones that are looking at a mucosal response. And hopefully we will see some benefit at preventing infection and transmission. That would be quite a game changer, in terms of reducing the spread as well as preventing severe disease and death. But the main focus was to keep people out of hospital, to keep people from dying from this unknown. I think many people forget about those early days. That first year of the pandemic was so incredibly difficult for so many people. And I can understand why we don't want to think about that early time. But there were no vaccines. There were no treatments. Hospitals were overwhelmed in so many different cities. And healthcare workers were doing their best to keep people alive. And it was really quite incredible, the devastation that it caused in terms of hospitalizations and deaths. Vaccines are incredibly effective. So again, when it is your turn, when you are advised to get an additional dose, please get vaccinated.
Thank you so much, Maria. And Mike, Maria was talking about different guidance when it comes to masks for health professionals and health workers versus general community. We got a question about vaccine recommendation for health workers. So maybe you can clarify whether the guidance when it comes to vaccines is the same or differs.
Yeah, I think the vaccine guidance is the same. The issue is the mandates may be different. So, in some jurisdictions require vaccination for health workers in order to work in the healthcare facility. Others don't, but I think many do, which is different. Many governments who don't have mandatory vaccination for the general community would have mandatory vaccination for health workers, because they're going to be exposed to that pathogen. So, for example, for hepatitis, if you work as a health worker, you have to be vaccinated against hepatitis because you may be exposed to that virus. So your employer has a duty of care to offer you protection against what would be considered to be occupational health risks. And therefore, a healthcare employer will look at what are the occupational health risks for our employees, and they'll grade them according to the type of worker. And sometimes they will say that for a particular type of health worker, mandatory vaccination against the following diseases is required. So very often that's the reason for a difference. I don't believe there's a systematic difference in the actual. The health workers are not being vaccinated with different vaccines. No. Everyone's getting the same. But clearly, there's a strong focus on making sure health workers are protected because they're the most exposed, and the impact on the system is very high. When a health worker goes down, then more patients won't be treated. So there's two reasons to prioritise health workers. One is they're taking the greatest risks, and two is if we lose health workers to the health system, then the health system becomes less and less efficient at dealing with the cases that are already there.
Thank you so much. And here is a very important question from a viewer watching us on Facebook, Vinicius Landera. I'm sorry if this is a wrong pronunciation. Do people underestimate the risk and impact of long COVID, or is it still a reasonable motive to avoid getting infected even when fully vaccinated?
So it's great that you brought this up because there is a significant risk. You know, we are learning about long COVID or post-COVID-19 condition, and there is a risk. There's an estimate of maybe 1 in 10 infections will lead to post-COVID-19 condition, and vaccination helps. There is evidence that's out there that suggests if you are vaccinated, your risk of post-COVID-19 condition reduces. It's also important to avoid infection when you can. We don't know the long-term effects of repeated infection from this virus. It's still relatively new. Even though we're 3 years in, we're in the 4th year of this pandemic, we still don't have all the answers for that. So protecting yourself with vaccination will not only save your life, prevent hospitalization, and prevent death, it'll also reduce your risk of developing post-COVID-19 condition. And this is something that WHO and partners are working with governments on to ensure that there is the appropriate care for individuals, whether they have an acute infection from infection and right away, but also after 3 months, or if symptoms come back, and that they have the right care, the appropriate care. And so there's a lot to be said for that. But I'm really glad the question came up, because I think we always need to mention post-COVID-19 condition whenever we talk about hospitalization, whenever we talk about ICU. This is a significant risk, yes.
Yeah, and I feel particularly for people out there that have any form of post-COVID condition, because as you said, the disease wanes and people forget about it. It's harder. I mean, it was maybe easier for people to live with this when there were lots of other people getting COVID. It was around you. You're post-COVID, but you had a COVID infection. Now, as we get further and further away from intense transmission, I think it's a lonelier place for people with post-COVID condition, because everyone else is getting back to life. And I'm sure there are those reactions that people have. Say, why aren't you back to life? Why aren't you back in the gym? Why aren't you, back on the football team? Why aren't you coming cycling? Why aren't you coming hill walking this weekend? And some people's lives have been transformed, not in the positive, but in the negative, by this infection, and they're struggling. They're struggling physically. They're struggling psychologically, and the support services in many cases just aren't there. So it's a real problem. And it's becoming a more difficult issue to continue to highlight. I know there are fantastic patient advocate groups out there, and many people in the medical and scientific side of things doing the necessary research. But this is this is a real consequence of this pandemic, and I do think that as time goes by, as people, and some people are getting through it after 18 months, 2 years even, some people are actually coming through it, and that's great. But there are still people suffering. And a number of people I know, people with otherwise no underlying conditions, younger people with very active lifestyles who are very handicapped right now and struggling. And we need to keep the focus on that. Find solutions, to give them the support they need until many of them will come through this naturally over time, and they need support in the meantime, and they need that support. And then we need to be able to find therapies that will allow people who are not maybe making it all the way through to get back to a reasonable standard of life. And we shouldn't forget this.
Thank you so much. Here's a question from Sophia, watching us on LinkedIn, who is asking, Maria, maybe you can take this as a mother of young children, how to protect them or how to help them avoid infection.
So yes, I'm a mom of two. I have a 12-year-old and a 4-year-old, and there are lots of moms and dads and grandmas and grandpas and aunts and uncles that are out there that are concerned about not only the older people in our lives, but also the younger people in our lives. It's about this approach of this layered approach, keeping yourself safe, keeping yourself safe from infection, but also from developing severe disease, also protects them. We've worked with our kids, in making sure that as they go about their daily lives, that they're washing their hands, which is not just good for COVID, but for any bugs that are circulating. And I mean, the world has opened up, so there are a lot of germs that are circulating right now, a lot of gastrointestinal bugs that are out there, where hand hygiene is incredibly important. My 4-year-old does cough etiquette where he sneezes into his elbow, and if I don't do it appropriately, he reminds me how to do it. We're really changing. Oh, Miro really, he really, but I think we're changing the behavior of our children. I mean, even in schools, and schools are open and need to remain open. There are ways in which children have modified what they do. They're living their lives, they're being educated, they're being supported, they're being fed, they're being nurtured, they're being protected. But as parents, we would do anything that we can. But it does start with us. It starts with how we are behaving and what we do to prevent from bringing that infection in, and then teaching them different ways in which they can keep themselves safe. But it's a combination of approaches, and also to talk to them. Kids are incredible. My 12-year-old, the questions that he has are tougher than any questions I have received at any Q&A, at any press conference over the course of the last 3 years. And talk to them about their fears, talk to them about what is happening, so that they also can be part of the solution. And kids have great ideas. Kids have better ideas than we have. And they need to kind of push us to say, maybe we don't need to do it that way. Maybe we can do it a little different way and keep ourselves safe. So I think as parents and everyone, whether you have kids or not, you can relate to this. What we do to keep ourselves safe, and the virus circulates in communities. So we have to protect communities, and that protects our kids as well. And in many countries, vaccination remains important as well for kids too. So follow the local recommendations that are there and get your kids vaccinated when that is appropriate for them, depending on their age and their underlying conditions. But that layered approach is really key.
Thank you so much, Maria. And Mike, any advice from you you're a father of a little bit older children?
Oh, yeah. Yeah. The ones getting themselves into the most trouble. So I think there's just no advice possible there. I think young people are out there living their lives. What I do see in a lot of young people, having gone through the pandemic, and a lot of young people got a lot of the blame during the pandemic. They were spreading the virus, they were doing this, they were doing that. And I think a lot of that was unfair. But I also think younger people are really tuning in. Maria was saying it earlier, you and I spent a number of days in Turkey and northwest Syria last week. I mean, there's a lot going on in the world. There's a lot of crises. There's, in Ukraine and in Syria, we've got 30 outbreaks of cholera around the world. We have 54 emergencies, climate change. There's an awful lot for younger people to process right now. You'd be forgiven to think we were, Chicken Little, the sky's about to fall in, right? And the job of younger people is to get on with it and create the future, and not become paralyzed by that, but to see, maybe like Cole, your son, ask the right questions, change the future.
Yeah.
So I have huge faith in the young generation that there's a future here that needs to be changed, because we can talk about all these threats we face, but so much of the threat we faced is because the world is unfair, because we haven't shared our resources, because we leave hundreds of millions of people in war and conflict and in unmanaged slums without access to safe water, without access to livelihoods. There's so much discrimination, be it racial or ethnic, gender-based, and so many other things that are wrong. And then out of the end of that comes a lot of the conflict. Out of the end of that comes a lot of the instability that leads to a lot of the emergencies and stuff that we end up managing. And it all starts with how the world is run. I know the question was really asked about how younger people are protecting themselves, but I'm more interested in challenging the younger generation now, that it's time to take hold of things, and it's really time to start shaping the world of the future. Because I actually think we have technologies and we have the ways and means to be able to really change the future. But we need to change the way we're behaving as a species on this planet. Our relentless exploitation of the resources of this planet, the relentless exploitation of other people on this planet, that's what's driving everything. And unless we change that, we can talk about all the technological solutions we like and vaccines and everything else, but at the end of the day, that's not what's driving the instability. We're living in an inherently unstable world, which is a wonderful, beautiful place to be. Humans are incredibly ingenious. You saw, and Alex, we were in hospitals in northwest Syria last week, and the passion and the commitment and the skill of people, health workers, after 12 years of war and an earthquake that took everything that wasn't knocked down, and to see those doctors and nurses and surgeons and amputee technicians and others just doing their work. I remember the three Fatimas, Fatima, and Fatima, the ladies who were working with the amputees on artificial limbs. And to think that one of the doctors in the hospital there had been displaced 7 times, because each of the hospitals he worked in had been destroyed in the war. So and yet I saw that energy, and I saw that incredible leadership given by the younger people who hadn't left. And I really do think we have to get our younger, and I mean younger, what's young anymore, what's old, but that next generation of people, rather than criticizing them, I think we really have to challenge them to be the new leaders, because there's so much to be done, and the world is so bloody unfair that something needs to be done about it.
Thank you so much, Mike. I know we're running out of time, but I have 2 questions left that I need to ask you. One is coming from a Twitter viewer. Everyone has COVID fatigue. They are not following the rules. Does this mean more variants are on the way? And one of the viewers before was asking actually what is the main strain that's circulating now?
I don't think, if people aren't following the rules, it depends what the rules are. But if we do create the conditions in which the virus can transmit more easily, we are creating more opportunities for the viruses to compete with each other. It's just a straightforward evolutionary arms race between the viruses, but they tend to become more transmissible as they do that, not necessarily more virulent or more dangerous. But every opportunity you give the virus to move from one person to another is an opportunity for the virus to evolve. And you add up each of those opportunities over a period of time, and it's hundreds of billions of opportunities. So we're in a lottery. So is buying 20 lottery tickets more likely to win than buying 40 when your chances are 1 in a trillion? Probably not a lot of difference. It's still more likely, but it doesn't really change the likelihood. So the the behavior of one individual doesn't really change the likelihood of a new variant emerging. The behavior of 10 individuals probably doesn't. But if a whole heap of individuals begin to behave in ways that are irresponsible, then that might. So it's a matter of how many people are engaging in behaviours that might be seen as risky. That may drive further transmission, and that may in itself drive the likelihood of emergence of new viruses.
Yeah. I mean, the same things hold true. The more the virus circulates, the more opportunities it has to change. That has not changed since day one. And the virus is circulating. So, we do need to take measures to reduce the spread as much as we can while we live our lives. The circulation, the viruses that have been sequenced and are shared with GISAID so that we can analyze are dropping. They continue to drop. And we've said this previously, but, looking at how many sequences are available to analyze is much less than it was a month ago, which is much less than it was 2 months ago. And that puts us in a compromised position. Right now, most of the sequences that have been shared with GISAID that are available for analysis are recombinants. And these are the XBB.1.5, XBB.1. That's about 41.5% of the sequences that are available. About 32% are BA.5 sublineages, and about 14% are BA.2 sublineages. There is no one subvariant that is dominant worldwide. Omicron, which is this family of viruses, includes more than 600 sublineages that need to be tracked. There are some that are on our radar higher than others because of certain characteristics they have. All of them are very efficient at transmitting. They all have a similar level of severity, which includes asymptomatic infection all the way to severe disease and death. Vaccination helps reduce that risk. Access to antivirals reduces that risk of severe disease. Wearing a mask helps prevent the spread. There's all of these different things that can be done, but there is no one subvariant that is in circulation. And I think it's important that we focus on this as individuals because the risk hasn't gone away. Your risk of infection hasn't gone away. You're reducing that risk with different measures that you take. Your risk of long COVID exists. It may be lower than it was previously earlier in the pandemic, but it's still there. And, we talked about this early on in the pandemic. Think about the person that you love most in this world. Think about your absolute favorite person in this world, and think about the possibility of them getting infected. That's why this matters, because you have an opportunity to play a part in preventing them from getting infected, preventing yourself and preventing them from getting infected. That's why it matters. What we want is not individuals out there to think about this every day and have it dominate their life and force them to not do things, because we're in a much better situation. But we need governments to remain focused, to remain vigilant on this, to reap the rewards of the hard work that they put in for the last 3 years, building on existing systems that were there and not dismantle them. Keep systems that are in place, support your workforce, because what you have is a system that can deal with COVID, it could deal with flu, it could deal with any pandemic threat that comes our way. So don't lose the rewards, don't lose the gains that we have made in those last 3 years. So it's about governments really paying attention to this. This is what we're firmly focused on. But as individuals, live your lives, do it as safely as possible.
Thank you so much. And just before we close, because there has been a lot of attention to lately on social media in particular around the origins of this pandemic. So maybe you can tell us what has been done so far to find answers where this virus is coming from and what more needs to be done.
So understanding the start of this pandemic and the origins of the SARS-CoV-2 virus remains absolutely critical for us. It remains critical for the world because we not only need to know how this pandemic began, we need to learn the lessons from that to prevent this happening again in the future. We will be dealing with outbreaks and pandemics as we go forward, but we can be better prepared. And we need to understand how this pandemic began. It really is a major focus of ours. And despite any reporting that's out there, WHO has not changed our views on this. We have not stopped work in this area. We are working on a technical level. We are working through diplomatic channels. We also have a scientific advisory group for the study of the origins of novel pathogens, the SAGO, which was established in 2021, which was specifically tasked at providing an independent assessment of the knowledge around the origins of this particular pandemic, making recommendations for studies and investigations that need to be done. And we are continuing to push to have those studies done. There are many hypotheses that are being evaluated. Some look at spillover events from either bats directly to humans, from bats through an intermediate host to humans. There are also hypotheses that are looking at breaches in biosafety and biosecurity, whether the virus entered the human population that way. But unfortunately, we don't have an answer yet, because not all of the studies have been completed. And frankly, it's becoming more and more difficult the longer time passes. So SAGO is working on, they provided a report outlining all of the work that needed to be done. We are working with China to ask and to request that studies continue to be carried out, and that the results of those studies are shared transparently so that they can be assessed by the international community. There are reports that come from the US that have assessed origins, but we have also asked for access to those reports. We don't have access to those reports or the underlying data that were made to use those assessments. This is not a game. This is not a political discussion. This is a scientific and a public health imperative. It's a moral imperative. And the debate that's out there that's turning this into a geopolitical football, as the DG said the other day, is not helping. In fact, it's detrimental. And I am exceedingly frustrated as the technical officer working with SAGO and working with people like Dr. Mike Ryan and Dr. Tedros and incredible scientists around the world. We need more collaboration. We need to stop the Twitter debates on this. We need to actually focus on the science. We need a real scientific discussion. I'm getting a little heated on this because we have to move the scientific debate along. Discussions about someone having evidence without sharing that evidence is useless. It's rubbish. Any evidence by any institution, any agency, any government, any researcher needs to be shared with WHO so that we can move the scientific debate along. Enough. Enough with this game that's being played. This is not a game to us.
It does a disservice to the people affected by this pandemic to see these geopolitical games being played out and people taking political advantage of that all the time. And it puts our scientific community under such pressure. The abuse that our scientists here have received over the years, the misreporting of their words again and again, scientific colleagues in different parts. I think our political masters and others need to recognise that at the end of the day, it's health workers and scientists in the end who are trying to do their jobs, and they become wrapped up in these hunger games of the political and other elites who just play. It's not fair. But life isn't fair, but it's just not functional, and it actually prevents the answers that we need been got. It actually stops progress, and it's very, very sad. And it's morally corrupt. It's morally empty. But then again, I don't expect much more from some of the players involved here. So it's just I hope we can get better. I really do.
Thank you so much, Mike and Maria. And maybe this is as well one lesson that future generations will do better in future.
Hope so.
I think it's tougher for people nowadays, and I do feel sorry for people because they are bombarded with misinformation and disinformation. They are being divided. They are being manipulated. And we are losing our right to think for ourselves. There's lots of rights in life. We believe in the right to life, the right to health, but the right to be able to think for yourself, the right not to be manipulated by powerful political media forces, the right to think, and the right to make up your own mind. These are things that are important, and it's not the case. It's just not the case anymore. We've lived through it for more than 3 years now. And that's why we need a new generation to come through and change this.
Thank you, Mike. And as tomorrow is International Women's Day, maybe we also need a new
Yes.
generation of female leaders, scientists, and health
ready.
workers. Yes, thank you. Happy Women's Day to all women, but huge thank you to women in science and health workers who are 70% women for all that they've been doing to keep people safe and healthy, and especially in those difficult times. And thanks to all our viewers watching us from Yemen, UK, Mexico, Qatar, Albania, the US, DRC, Israel, Egypt, Ghana, Iran, India, Uganda, Tanzania. The list is long, includes Ireland as well. So thank you so much. Stay with us on our social media channels or other ways. And we will close with Mike.
No, because today's been not an easy day, work-wise in many other ways, but not an easy day as well, because my best bed in the world has been on an operating table most of the day, and I just learned in our prep and just as we got ready that he's through his surgery. His name is Fintan. He's been my best friend since we were knee-high to a duck, so I'm going to drink a glass of champagne to celebrate his coming through the operation. So best wishes to him and his wife, Jo. I know he'll see this at some point. He won't see it for a few days, but it's just sometimes in life good things happen.
It's good, and thank you for having time for us and our viewers on this very heavy day for you, Mike. But I'm glad it ended with good news. So thanks, everyone, and goodbye until next time.